If you're a nurse or healthcare professional striving for growth, balance, and career success, you'll love The Nurse Keith Show. Hosted by nurse and career coach Keith Carlson, this podcast delivers invaluable advice to help 21st century nurses thrive. On The Nurse Keith Show, Keith explores career management, self-care, social justice, and even entrepreneurship. Through inspiring interviews and expert insights, he'll help you create a satisfying career and life. Listen and follow The Nurse Keith Show on your favorite podcast app, and you can find all the links that you need at healthpodcastnetwork.com/nursekeith. That's healthpodcastnetwork.com/nursekeith.
Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Welcome back to part 2 of our conversation with Little Manila Rising. We're going a little bit deeper this episode. Think about a Filipino grandmother sitting across from you, describing her grandson's struggles. She doesn't say depression. She doesn't say anxiety. She says broken-mindedness. This phrase reveals everything about the gap between how communities understand mental health and how we are trained to treat it. In part 1, we heard a little background about Little Manila Rising to set up the context for this. Because this episode will dive into the harder question. How do you provide care when cultural values that once protected communities now sometimes prevent healing? Hannah will share utang nulub, a cultural value about family obligation, and how it drives certain immigrant children toward perfectionism and away from asking for help. You'll learn about bahalana, leaving it up to God, and how spiritual strength can become a barrier to mental health, especially when families tell their children to, quote-unquote, pray it away. And here's the insight. Hannah and Quintel don't see these as problems to solve. They see them as strengths to work with. And that's a reframing that's really important, because when we start dismissing cultural values, that is not culturally responsive care. So today you'll hear specific strategies that you can start using next week if you want with the Filipino community. You'll also hear about how churches become gateways to Filipino elders, while understanding that family involvement isn't interference, changes everything about treatment planning. And Hannah will remind us, which is one of my favorite ideas, that trust isn't built through perfect clinical care, but built through just showing up when people are suffering. Without further ado, here's Hannah and Quintel. I appreciate what you all are speaking to. And I think something that I learned through the COVID vaccination efforts was about how trust is hard to build. And so much of it is about people who are trustworthy. So you trust somebody when they're trustworthy, if that makes sense. And often healthcare institutions aren't trustworthy for many communities because they've been historically harmed, excluded, you name it, from these institutions. So when all of a sudden we come and say, hey, you should take this vaccine because we tell you it's safe, people are like, I don't know, that's not what I heard. So it's a message that resonates differently if it's coming from the community itself, from leaders who they believe, who they have a relationship with. I want to also build on that a little bit because we've talked about how a community's health can be affected by social health or social determinants of health. So much of the work is providing access, providing the services themselves. And then there's a part of that is also advocacy. So we can address some of the structural inequities, which is partly historical, where people are excluded. And the last part that I often find that is important to address is the cultural values themselves. We mentioned it a little bit here and there, but part of the values that's come up in a lot of our episodes is that some cultural values were originally protective for the community in the context, but then they had come to America and those same values were often used against them or causing them harm.
When we're doing the Filipino intergenerational wellness study, we heard a lot of generational clashes when it came to perceptions about mental health. And seeking professional support, there were a lot of shame and a lot of guilt among the parents if their children were going through a mental health struggle. And for some people, they didn't take it seriously until they had to be 5150 or hospitalized. And going back to the generational differences in values, the Filipinx community is very focused on relationships with each other. They're oftentimes in multi-generational households. And so when they immigrate into America, some people may clash with the pressures to be independent when our culture is highly interdependent. We all are very community driven, family oriented. For some families, I don't want to overgeneralize. And that can be hard when a community member or a family member says that they're struggling with depression or anxiety. They may want to take that within the family themselves, and they may feel a sense of guilt too, that maybe it was their upbringing or maybe it was their parents who didn't raise them the right way, quote unquote. Like in the Filipino community, there's also a lot of chismis. I don't know if you've ever heard that word, a lot of gossip. And so they want to make sure their family is doing well, or that they're bringing honor to their family and not bringing shame. And so that looks sometimes manifests into people pleasing and perfectionism and overachieving and high functioning anxiety. That makes it hard for some children and teens and families to be honest with how they're feeling, in fear of what their parents are going to think of them or what their family's going to think of them. And that affects them from wanting to get therapy, for example. I feel like we could talk about the whole stigma on therapy and mental health for days, but it is still highly stigmatized. It's still associated with being crazy or linked to. We just had a Filipino mental health focus group on last Monday, and they said broken-mindedness. And when we look at the language that elder generations are using when they're talking about mental health, there's not a lot of language in their native tongue either. In Tagalog, there's not a lot of languages around or translations around mental health. It's a taboo topic. But then there were parents and families who really valued the open dialogue, even though there was internalized shame or stigma. There were some families that were really open to talking about their feelings, talking about problems, talking about their relationships, talking about how they could heal from trauma, right? A big thing about Little Manila Rising is we are the community, right? We hire people from the community who have lived experiences, who have seen intergenerational trauma being passed down through their family, who are from South Stockton, right?
I think that's a gift of being led by the community itself, because sometimes if you're not from the community, it takes a lot of time to just explain what the stigma is. You're like, okay, let me break this down for you. This is why there's a stigma, compared to people with Little Manila Rising. You're like, yeah, obviously there's a stigma. I'm part of it. I've experienced it. So let's go on to the next step of what should we do? How can we support the community, rather than spending so much time explaining it and understanding it? You already have that understanding, so you can actually go on to try to see, quote unquote, solve it, whatever that means. I'm curious you just talked about a generational divide. Do you feel like it's supportive for both generations? A community that is strongly rooted to Asian values, wherever they were from in Asia, to this new generation, which is attempting to build a new identity that's a mix of American and your own country's values. And mental health is where there's this divide that you just named. And if Little Manila Rising is trying to care for both of them, how do you do it? It seems so hard or complicated, because what you make for one may not be the right for the other, right?
We definitely even saw that in the recruitment. That was really hard. We didn't get a lot of elder generations. We did have a 90-year-old, so that was amazing. She had a lot to share about mental health perceptions. But other than that, it was a lot of younger generations that were more open to talking about mental health and talking about wellness. We did have a Filipino intergenerational wellness panel where we did have both generations represented. We try to cultivate those spaces so that they could both share their perspectives, but you could tell there is some like clashes in some of their perspectives. I think one cool thing is that food really brings people together no matter what generation it is. If you bring food there, they will definitely come out there. If you bring the lechon, that's like roasted pig in Filipino celebrations and parties. We always joked about that with the researcher and our team, like maybe that's how we could get people to come out. But also a key thing to working with and accessing and reaching elders is working with churches. And that's the same thing that we learned for the Filipino Family Health Initiative with Dr. Joyce Javier. They were really able to reach older generations and Filipinx families in the church. Because one of the values in the Filipino community is this concept of bahala na, which means essentially like leaving it up to God. And oftentimes, if it's not a therapist, then it's a priest or it's a pastor that they're going to talk about mental health. In some ways, it could be harmful where parents or family members could just tell their children or family members to pray it away if they're going through like a mental health struggle. But definitely in our experience, we have been able to better access and reach the elder community, again, through the churches. Like our actual clinic, we used to call it the Asian Health and Healing Clinic. Those happen at Trinity Presbyterian Church, which is in South Stockton. And it also has historic significance to the Filipinx community. It was actually the first church where the manongs and manongs congregated and prayed together. Dylan Delvo, his dad was a manong and he went to that church. And so us being able to actually provide healthcare services that are culturally rooted, that are accessible to the community is mind-blowing, right? Like we are able to provide these healthcare services that otherwise wouldn't been provided in the South Stockton region. And again, like we've heard from people who are really close to Dawn that they felt her spirit in the space. And yeah, it's like when they said that, I just got so much goosebumps because it again is a reminder that we're doing this for our ancestors before us.
I think there was something really neat about the surveys that you did, that it was intergenerational, even though it was hard to recruit people from the elderly generation. But there's this hope that, there's a conversation that occurs between the different generations and that there's like overall healing that can occur from sharing the results of those surveys among the wider community and showing that these conversations are happening, that, there are shared goals between the different generations, even if cultural values are different. So I really liked that part of it.
Yeah, and I'm just reflecting on everything Hannah has mentioned and my own personal journey with mental health and the intergenerational dialogue I've had with my family. I think is really key because with younger generations, I think we could play a really key role in challenging the stigma while promoting acceptance in the intergenerational dialogue with older family members about mental health. And over time, the goal would be hopefully a non-judgmental and an empathetic manner of discussing mental health. And I know it's easier said than done, but encouraging one another with lived experiences of mental health challenges to share stories openly and authentically. And I think we've really done a good job about that with our focus groups, our listening sessions, and even our town halls. And I think particularly older adults are seen as our role models. So if we are able to share our stories, hopefully we can allow them to share their personal narratives and even humanize mental health illnesses, challenge the stereotypes that our Asian communities go through, and even demonstrate that, I know Hannah brought this up earlier, our community sees oftentimes like mental health as a sign of weakness, but we are trying to dismantle that and let them know that seeking help is a sign of strength. And it brings me back to like our core Asian values of highlighting perseverance, harmony, familiar support, and a big thing is resilience. And I think when seeking for support for mental health concerns and also sharing your voice is consistent with all those values and can really contribute to overall well-being and hopefully harmony within our loved ones.
As a clinician, imagine there is a healthcare professional or clinician in a hospital close by to South Stockton. They're not directly related to Little Manila Rising, but they care for the Filipino community. How could they best support the work that you're doing? Because I take care of a lot of Filipino patients, but I still only have, would you say, 5 minutes, 10 minutes to see them. How can I best be part of the solution, even in this current structural inequities that we're working within?
I think a few things that come to mind would be what I mentioned earlier about cultural competency and culturally tailored care. So for healthcare practitioners to adapt and meet the cultural, social, and linguistic needs of our BIPOC community, I think is really key. This might involve incorporating culturally specific health beliefs and practices into their treatment plans and offering alternative therapies. Although if it's not like their niche and not their forte, maybe they could refer them to someone that helps with, for example, pain management and long-term sustainable practices. I can refer you to them while being respectful towards their preferences and also acknowledging that there's a huge aspect of family involvement in one's care. So allowing their family to feed in their opinions and emphasizing that they too can be a patient advocate wherever they. And another big thing is trauma-informed care. And I think like recognizing and addressing the impact of historical trauma. And as Raj mentioned earlier, and also the inequities people face within the healthcare system, just being mindful of that and that patients or community members might not right away be receptive to your treatment plans, but in due time, hopefully they will be. And just being mindful of the social determinants of health that we mentioned within our communities and how it impacts their well-being. And with the trauma-informed care that emphasizes safety and that trustworthiness and giving them the choice to choose whatever works for them because one size does not fit all, and allows the healthcare provider and the patient to collaboratively work together to come up with the best plan for them. And that empowers them to continue to advocate for themselves and hopefully dismantle the trauma and discrimination that they went through in the past.
So I think that was well said on being aware of trauma and focused on trauma-informed care, especially entire communities that have gone through something like this. And if you're close to South Stockton, understanding the history of what happened, of this threat of losing their entire community and how much that probably still resonates with people living there. And the second part is the awareness of the history, specifically general Filipino history, but also what's happened in your neighborhoods. And the third is the relationship. I was thinking, you didn't even say this. You could have just plugged your Little Manila Rising, meaning plugged your organization saying, hey, like if you're a provider in this area, you should know us, know what we're doing, and make sure if you see your patients, they can connect to us if they really want care that's culturally responsive or grounded. And I think everybody to know what's in their community. And if it's not, advocating for that, because healthcare professionals do have a lot of power in their healthcare professionals. So their voice is often heard. And we have to be intentional on how we advocate for that voice and making sure that, as you said, center the community and what their wishes are rather than what we think they need. And that's an important point there too.
Yeah, I think definitely them committing to their own research instead of like asking us directly, because that's also a lot of labor, us to like share it directly to the community. It's different when they're deeply committed to learning themselves, like reading on different articles on Filipino mental health, reading on the article that Dr. Joyce Javier mentioned that helped shape her program. And I think one big point is actually being in the community. I think that makes all the difference. Like actually going out to these events that we're hosting, like the health clinics and the different wellness workshops, and hearing from the community members directly.
I think what makes a world of difference to build trust, to just show up. It seems so basic, but just show up and people will start trusting you more rather than if they just see you in your place of work, whatever that is, hospital, clinic, some kind of healthcare delivery place. Last question that we ask all our guests. Thinking of the theme today, we are focusing on culturally responsive care, specifically in the Filipinx community. My question to you all is, have you had a good experience with the healthcare professional that was culturally responsive that you want to share with others? Or the flip side of something that went really bad because they kind of ignored the core part of your identity and it made you distrust healthcare?
Yeah, I think for me, just helping them be a patient advocate for them. And when we go into healthcare system, like I would ask, are you able to provide language interpretation services or even offer translated materials to help them to learn about prediabetes or hyperlipidemia, or if they're at risk for developing hypertension. So just ensuring that they get that effective communication with their healthcare provider, and even interpreting their lab work. Like, is there someone that can help break it down for them? Like, for example, if one of my parents is at risk for hyperlipidemia, maybe they have to avoid eating that lechon like at every family party and resort to some salads and other food. So if they did have an Asian provider, not from the same ethnicity, but I think within the Asian community, like food is a huge thing. So just relating to them in the cultural context has helped them be more trusting of the healthcare system. And that also helps me learn how I want to be a patient advocate for myself whenever I go to the hospital or seek for mental health services.
Yeah, I'm thinking about mental health specifically. Although I haven't had a Pinay or Filipinx therapist, I do have an amazing one that understands the family obligation piece that I experienced. There's a phrase called utang ng loob. It's translated into family obligation. A lot of daughters of immigrants, children of immigrants, feel like they have to carry it all and be successful. That has definitely affected my own mental health, feeling like I had to take care of everything on my own. And so one thing that my therapist would tell me is she would remind me, because of how interconnected our families are and the Filipino culture is, to reach out to community and to remember that I'm not alone. Because oftentimes in Western culture and Eurocentric culture, they frame self-care as something, it's your fault. Like it's something that you have to do on your own, right? You have to go exercise on your own, or you have to pray, or you have to do all these forms of wellness that they use to capitalize. And I think when I think about my own wellness, I appreciate that my therapist reminds me I should also tap into community care. I should reach out to people when I'm feeling isolated. I should reach out to family, even though I may have internalized shame to ask for help. It's so ironic. I'm in the mental health field. I want to be a therapist, but sometimes I have to unlearn the shame and stigma of actually saying that I need help, that I'm not okay. I owe it to my community. I owe it to Little Manila Rising. I owe it to empowering marginalized Asian communities, Hospice of San Joaquin, who really helped me go through waves of grief when I lost my dad during the pandemic. So when I think about your question, I think about how my community is mirroring the help that I need and the help that our community desperately needs. You don't have to have the same background. They don't have to have your same story. They don't have to look like you, but they have to just have that deep understanding that they need somebody there to listen to them and to care for them and to authentically and genuinely want to see them thrive and to see them well and supported. So, yeah.
Thank you so
I'm really
much,
glad that
Hannah.
you asked that question.
Thank you. That was really well articulated. And I think that's our hope in all the work that we do, that healthcare and our health organizations show up in that way. So thank you for all the great work you all are doing. I'm sure you're making a huge impact, and we're so glad to support and amplifying work they're doing.
Thank you so much for your time today, sharing the heartfelt that goes on behind Little Manila Rising. And hopefully we'll stay in touch. So reach out if there's anything ever that Raj and I can do for you. Really appreciate it.
Thank you so much for
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.